rate of persistent MRD after induction and high rate of relapse. And the long-term overall survival with chemotherapy is poor. And PH-like ALL in one study at least can constitute almost 20% of all PH-negative B-cell ALL diagnosed in the US. So what we did here, we tried to compare outcomes of transplant in patients with PH-like and PH-negative, non-PH-like ALL. And it was a retrospective study. And we analyzed archived samples from adults transplanted for B-cell ALL PH-negative between 2006 and 2020. And we use our own next-generation sequencing panel that has the ability to kind of detect all novel fusions for PH-like, as well as increased gene expression that diagnose PH-like ALL. And here we present interim analysis of the first 94 patients we analyze. In patient characteristics, I mean, when we test for PH-like, almost 2/3 of the patients were PH-like in this population. And our population was enriched with this disease, most likely because the location of our center in Southern California and PH-like ALL tend to be at high incidence in patients with Hispanic background. Plus, these patients went to transplant, so most likely they have some evidence of high-risk disease, either because persistent MRD. So this is why I think our population was kind of enriched with PH-like ALL. So of the 94 patients, 33 had other B-cell ALL. We have 26 has PH-like, non-CRLF2, and we have 35 patients with PH-like with CRLF2 rearrangement or overexpression. Characteristics of the patient, the significant difference was patients with PH-like CRLF2, they are more frequently Hispanics, 91% compared to 65% in the PH-like non-CRLF2 and 50% in the other B cells. Also, the PH-like ALL CRLF2 rearranged, they tend to have standard risk cytogenetic, while other B-cell ALL, they tend to have more high-risk cytogenetics. Other difference between the different group, that patient with PH-like, especially the CRLF2, more frequently, although not statistically significant, they were treated with blinatumomab before transplant. And also there was kind of trend toward higher incidence of receiving inotuzumab as well. But other characteristics were similar between the different groups. Now, looking at the transplant outcomes, overall survival was similar in the three groups. And in patients with PH-like ALL, both CRLF2 and non-CRLF2 rearranged, they have 3-year overall survival close to 55%. Leukemia-free survival was not different. However, relapse, there was increased incidence of relapse in PH-like CRLF2. It was up to 53% by 3 years. In patients with other B cells was 31%, and PH-like non-CRLF2 was 20%, and the p-value was 0.05. Now, non-relapse mortality after transplant was similar, although the curve for the CRLF2 PH-like, it's kind of lower than the both other B cells and the non-CRLF2 PH-like ALL. Part of it is because, although not statistically significant, they were kind of younger patients. So what we conclude from our study that allogeneic stem cell transplant is associated with encouraging outcomes in adults with PH-like ALL, and 3-year overall survival was 55%. And this appears better than what we can achieve with chemotherapy. Keep in mind, many of these patients were CR2 and CR3 when they went through transplant. Relapse remained the leading cause of treatment failure, especially in patients with CRLF2. And survival outcome was not different between PH-like and non-PH-like, but the study is kind of limited with a small cohort, and hopefully by adding more patients, we'll have a better conclusion. I would say that allogeneic stem cell transplant should be considered for patients with PH-like ALL and CR, but we have to work more on reducing the relapse rate, either by additional pre-transplant therapy to deepen the response, or possibly some maintenance approach post-transplant to reduce the relapse.